So our next speaker is Tiffany Boughtwood. She's the Managing Director of Australian Genomics, and this is an Australian government initiative that supports genomic research and how it can be translated into clinical practice. And you just heard in that last session just how important genomics is. Tiffany has 25 years' experience in molecular biology, leading academic programs, collaborating internationally. She served on the World Economic Forum on Global Future Council for Biotechnology and the WHO Collective Global Network for Rare Diseases. And she's going to share with us the roadmap for genomics in Australia. So please welcome Tiffany Boughtwood.
Thank you, Sophie, and hello everybody, and welcome to those who are joining us online as well. It is just so wonderful to be joining the conversation here today, and I'd like to also acknowledge, Ali and Anita, thank you for sharing your experiences. I think, Jane and I were discussing last night, do we need to give a bit of a preamble about genomics? But I think in sharing your experiences, you've also really demonstrated the importance of genomics to really manage cancer and, rare and less common cancers in particular, so thank you. So as we begin, I would also like to acknowledge the traditional custodians of country, the Ngunnawal and Ngambri people, and all the various nations that are joining us today virtually. And I'd also like to recognise what a difficult time this is for the First Nations peoples of Australia. So in 2016, I spoke of how rare and less common cancers had affected my family, as it has so many of us, and our loved ones. I spoke of the sense of waste and futility against rare and less common cancers, and the fact that the management of these cancers has not kept pace with health innovation. Forward. I also spoke of the dangers of incrementalism and the fact that staying on the same path of treatment and practice will not suffice for such a, when there's disruptive technologies available. And I spoke of the need to grasp the nettle and really embrace genomics as a disruptive technology that can change the outcomes for peoples with rare and less common cancers and other genetic disorders. So, slide. Why don't I just do this when it's time for you? No, back one, blue. Thank you. So how have we advanced in those last 7 years since I last spoke in this forum? How is Australian healthcare adapting and adopting genomics to tackle rare and less common cancers? And are we keeping pace with international best practice? Excellent, thank you. So the promise versus the challenges of advanced health technologies is a Gordian knot that we have struggled with for years. Thank you all. Okay. How do we realise the benefits of genomic interventions in a health system ill-equipped to deal with them and adopt them? Some of these challenges have been unpacked in various sort of policy reports. So there was the New Frontiers report, the Zimmerman-Freelander report that addressed many of these policy changes, and Mike remains a staunch advocate for the need to adopt these changes. We are seeing some of those progress, such as in the HTA review by Medicines Australia. The Cancer Australia is progressing a national framework for genomics in cancer control, and of course today the launch of the Rarefication report, which, as Christine says, outlines recommendations that are reasonable and rational and should be achievable for Australia. The challenge we all face here today is that the promise of advanced health technology will not be realised for Australians without a paradigm shift. A novel, transformative approach that needs to be nationally coordinated, it needs to be powered by data, health data, it needs to be supported by health technology assessment reform, and it needs to be based on research investment. But adaptation is hard, and in the eyes of families and people living with cancer, it's all too slow. Hey, the Australian health ecosystem is complex, with shared responsibility for health delivery between the Commonwealth and state and territory governments. And in that, we have the incumbent risk of cost shifting and responsibility shifting between these stakeholders and payers. Then if we overlay the Australian genomic health ecosystem, we get another layer of complexity, with intersections between research and clinical practice and the need for a virtuous cycle between research and clinical practice, the need for rapid evaluation, assessment and uptake of genomic health interventions, and a health technology assessment system that requires a major overhaul to adapt and be responsive to innovative health technologies, as well as legislative change that needs to come through to protect Australians to fully adopt genomic technologies. So, as the report states, the implementation of genomic medicine will really require a revolution across the healthcare system involving data, involving health technology assessment and evidence through policy, through education of our publics as well as our workforce and research to really drive this evidence-based healthcare. But I do have hope. There is gathering momentum behind genomic implementation into healthcare and driving genomic cancer diagnosis and cure for Australians. So Australian Genomics, we were funded by a NHMRC targeted call for research in 2016, and we were charged with preparing Australia for the revolution in genomics in healthcare. We undertook 19 different clinical cohort studies across rare diseases and cancers and built evidence through those cohort studies to look at cost effectiveness and clinical implementation of genomic technologies. We developed resources for the community as well as for upskilling health professionals, and we also developed infrastructure for genomic information management and health information management to ensure that Australia was digitally ready for undertaking the genomic revolution into healthcare. We've been busy, which is probably why I look substantially less fresh-faced than I did in 2016. But now it's a bit twitchy. And we're not alone. So there are global efforts to support the implementation and integration of genomics into healthcare. So Australian Genomics is a driver project for the Global Alliance for Genomics and Health, which sounds a bit Star Warsy, but there you go. And as a driver project for the GA4GH, we get up at all hours to talk genomic data with genomic data geeks from across the globe, and it's wonderful. Only through these genomic global efforts can we progress genomic data sharing, knowledge sharing, for the benefit of not only Australians, but for all humanity. The World Health Organization recently convened a 15-member technical advisory group on genomics in response to the WHO's first Science Council report to the Director General, which provided 15 recommendations to support global benefit of genomics to all nations. It focuses on advocacy and promotion, implementation, collaboration, and ethical, legal, and social issues. We had our first meeting in Geneva just a couple of weeks ago, and there's clear recognition for the need to support the implementation and access to genomics, not only for low and middle income countries around the world, but also to underserved communities within our high income countries. And I think this is where an area that Australia still has a lot of work to go. If we look at examples from the NHS England Genomic Medicine Strategy, for example, they're now upscaling their activities to meet the needs of thousands of patients a week for comprehensive cancer profiling. So that this, genomic-informed healthcare is available now. It's just not available here. So this is an image I'm sure you're all familiar with. It, adorns your walls next to your favourite band photos. Why have I got the Department of Health and Aged Care up on the screen? So in February, we had a restructure to the Department of Health and Aged Care. Joink. So this was last year's structure, of course. Last year, genomics was in the remit of the Strategic Policy Branch, which also, has it got a duva? No duva. You'll just have to imagine. There we go. So it was under the Strategic Policy Branch and the later stages under Blair Excel as the DepSec, and the lovely Claire Firth was taking care of this work. This branch also deals with research, NHMRC, the MRFF. So genomics was considered sort of future strategy, still gathering evidence, still a maybe on the horizon. If we look to this year's structure, joink, under Renee Lucchese and the Penny Shakespeare's portfolio of health resourcing, there's been established a new branch within the department, Genomics and Health Technology Assessment Branch. And the importance of this, in my mind, is that genomics is no longer a future vision, a maybe in the space of research. It is now. They are considering implementation of genomics through health resourcing and how to implement it sustainably into healthcare. And I can say after 8 years in this particular gig and about as many DepSecs, I've never worked with a branch that has been so engaged, so willing to come to conferences and chat with patients and people with lived experience than Renee Lucchese and her branch. There's really been a shift in culture within the department, and that really is something that offers me hope. And Genomics Australia, yay. So Genomics Australia was announced by the former Minister Greg Hunt pre-election. It survived the change in government and also the October budget, though I had a dicey evening there where I wasn't sure it did, and is now moving forward. So an expert advisory group has been convened, chaired by my boss, Catherine North, with Penny Shakespeare, that is providing advice to the Health Technology Genomics Collaboration, which is like the new flavour of RMAC, about the roles and priorities of a national genomics entity. And they're also seeking guidance from the Aboriginal and Torres Strait Islander Advisory Group on genomics. Okay. So why are Genomics Australia? So I think there's certainly been a number of consultations over the past few years that point to the fact that there needs to be a national coordinated approach to the development of genomic policy, irrespective of the shared responsibility for implementation of healthcare, sort of at the state and territory level. We need to look at barriers to adoption of genomics from both the digital readiness perspective, but also the policy perspective that Jane will be touching on. And we need to also ensure that we're bringing the public with us, that we're responsive to societal shifts and perspectives about adopting new technologies into healthcare. Oops. I thought I was going to go for it again. No, all good. So potential roles and priorities of Genomics Australia, these are still being defined by the expert advisory group, reporting to the collaboration in conjunction with the Indigenous Advisory Group on Genomics. But these are some of the early themes that are coming out in those discussions. There's certainly an emphasis on genomic information management and ensuring that aligns with the Commonwealth's digital health agenda that they're currently progressing through My Health Record, etc. The importance of workforce capability and capacity, I believe, will be a big emphasis of Genomics Australia. But I think too, keeping that sort of watchful lens on consistent, safe and equitable access to genomic technologies, not only for common conditions, but also the rare and less common conditions. So I do hope, I remain vigilant, but I do hope. And I think, so I'm pissed off at the pace of change. I don't want to be here in another 7 years and still banging the genomics drum. But I think, importantly, we are seeing shifts at a structural level in the Department of Health. So we all need to navigate this course between the devil of, there we go, the status quo and inertia in healthcare, and the deep blue sea of the complexity and challenge of integrating genomics into healthcare. I will continue to have discussions about the legislative changes that we need to support genomics. I will continue to agitate for changes to health technology assessment to better support the integration of genomics. And this is where the work of advocates like Rare Cancers Australia is so critical, that we do not accept complacency and incrementalism. And we do fight ongoingly for health system adaptation and adoption for the better of all patients with rare and less common cancers. Thank you.